We're here at Glaucoma 360. You gave a presentation on Glaucoma Genetics. I wonder if you could elaborate more on your talk.
Sure. I mean, one of the things that is really exciting about the glaucoma genetics research now is that we've finally gotten to a point where we can actually start asking really meaningful questions about how the genetics influences clinical features of the disease, and how we can begin to use this genetic information to identify novel targets for therapies that have the potential to be curative and also, protective and preventative, which are really our goals for taking care of glaucoma patients.
Now, you presented 4 examples. Could you kind of outline those a little bit?
Sure. So there are actually a number of emerging targets from the genetics work, but I focused today on 4 because I think they illustrate important points about how we use this genetic information to develop targets. The first was myocin. Mutations in myocin are known to cause severe early forms of disease, and there are now emerging gene editing therapies that will get rid of the mutant forms of the protein and allow the intraocular pressure to return to normal. This would actually be really a potentially curative therapy for patients who carry these mutations. Second, I talked about TEC, or Tie2, and angiopoietin signaling. This is a new area for glaucoma genetics research. We've only in the last few years found mutations in these genes that are important for glaucoma patients, but they point to a role of Schlemm's canal in disease development, and that opens a whole new area of potential therapeutics for delivering molecules that would enhance TEC and Tie2 signaling, and delivering these potential molecules actually to Schlemm's canal in the patients who have defects in those genes, which would be most likely to benefit from this kind of technology. I also talked about the relationship between cholesterol metabolism genes and glaucoma and intraocular pressure, which could point to the use of statins, which of course inhibit cholesterol production as a possible therapy for glaucoma patients. And finally, I talked about the role of mitochondria in retinal ganglion cells and also in intraocular pressure, and how mitochondrial dysfunction seems to have a role in both processes, and repairing mitochondrial function or restoring the normal antioxidant balance in mitochondria could be very helpful in terms of managing intraocular pressure and also preventing optic nerve disease in patients with these defects.
Should ophthalmologists then consider adding a genetic component to clinical trials?
So it was one of my summary points, and yeah, I think that one of the things that we have to consider going forward is that not every glaucoma patient has the disease for the same underlying reasons or the same genetic mechanism. And some therapies are going to be much more effective in people because they're targeting a particular genetic predisposition. And identifying those patients could definitely influence how well they're going to respond to therapies, especially new therapies that are potentially developed based on these genetic targets.
And where do we go from here?
Yeah, so where we go from here is we're doing well. I think we have really increased the number of genes known now to contribute to glaucoma than where we were, say, 20 years ago. But we're still not at the fully comprehensive state where we've completely defined all the genetic contributions to glaucoma. We lag, in fact, behind other common complex diseases like age-related macular degeneration. So we need more genes, and we're, through collaborations, which really have been key for the progress we've had so far, but through collaborations, we're now greatly expanding the number of cases and controls that we can analyze, which will give us a lot more power to find additional genes.
Okay. Thank you very much.
Thank you.